It's got hundreds of uninsured patients per week, running up a bill better than $1 million per week, and that's just at this hospital. It's a crisis so out of control. Here at University Hospital, they're even seeing people without dental insurance coming in here to be treated for toothaches. The best example of the uninsured patient problem in Louisville is 100 miles away near Cincinnati.
He lived on the street, and because he came to us so much, he was actually giving our hospital as his address.
Yes. How you doing?
Dennis Manners racked up so many visits over so many years, University Hospital sent him to this addiction treatment center.
He would come to our facility a little over 25 times a month, sometimes upwards of 3 times a day.
Just go to the hospital all the time.
How much can an uninsured homeless guy really cost to care for? $468,000 in bills this past year.
And I was depending on them, and I really thought they would kick me out the door.
You can't say no to anybody that walks into the emergency room.
22% of the patients coming to University Hospital these days cannot pay anything. Tell me about your insurance situation. Do you have insurance?
I don't have any insurance at all.
For some people, it is their only option. They don't have the copay, the $15, the $20 copay that is required before they can be seen in one of the community health centers.
Our investigation finds indigent care costs at University Hospital rose sharply to $88 million last year. Government reimbursements totaled $67 million, for a net loss to the hospital topping $20 million. Norton Hospitals reports $69 million in unreimbursed indigent care for the year, $49 million in reimbursements for a loss of $20 million. And Baptist Healthcare reports a charity care net loss of $35 million, unreimbursed Medicaid loss of $25 million, and $20 million lost in bad debt, which is people they thought could pay but didn't. That $80 million loss is an 80% increase from just 5 years ago. And guess who's paying?
All of those costs basically are shifted to premium to the commercial payer. And that's how you make up for all those losses on the governmental side and the charity side with the premium, through commercial payers.
So 6 months ago, University Hospital started taking a closer look at frequent visits by uninsured patients.
What I'm seeing is that people are trying to hold on to the providers that they had when they had health insurance, and they struggle to pay those doctor bills, and they finally get to a point where they're just no longer able to do it.
It's getting so out of hand, people without dental insurance are showing up with toothaches.
Because I was blacking out severely, and the pain was so strong that I couldn't do nothing.
If they're in pain, they can't turn them down. Sometimes, as in this case, they have to admit the patient to pull a tooth. Imagine what that costs in a hospital.
I don't have no insurance.
Do you have a job?
I don't have a job.
How long has it been since you had medical insurance?
Never.
How can you prevent somebody, though, from just saying, I'm just going to keep going to the hospital, University Hospital?
It's a matter of every time they come in, you're there talking to them.
And that's why everyone says the existing system's not sustainable.
Now, to give you an idea of just how fast this problem has grown, just 6 years ago here at University Hospital, their net loss on indigent care was just over $1 million. That number has grown to a net loss of $20 million this past year. To see more on the numbers, the progression of indigent care costs here at University Hospital, we've posted all that on wave3.com, as well as extended interviews with all the people you just saw in that report.